Okay, greetings everybody. I appreciate everyone who's here already. Anne and Joy and Andrew and Andrea and iPad 84, whoever that is. So I'm Andrew David Shiller, and I'm a doctor who specializes in physical medicine and rehabilitation, though I also did an internal medicine residency. And the real thing I want to talk about is, where are we in these slides? Sorry. This problem of chronic pain, like what causes chronic pain syndrome and what can you do about it? Because the fact is that there's a lot of people who develop pain who hang on a second. I'm going the wrong way. My apologies. Like, why do some people suffer instead of getting better? And the reason I got interested in this is because I specialized in physical medicine and rehabilitation. If you don't know what that is, it's also called physiatry. And basically, it's kind of like learning orthopedics and neurology and rheumatology and neurology and like studying all the organ systems with a focus on how to help people get the best quality of life. And typically through non-operative means, through lifestyle of multidisciplinary rehabilitation. And so I saw a lot of people with pain problems, people after trauma, people after bad injuries, serious illnesses, degenerative illnesses, neurodegenerative problems, just a ton of painful suffering, and seeing that the biomedical model didn't really solve the problem for so many people. And so I finished my training at Harvard Medical School and I started working in the community, and I could help like less than half of the people who came in my door. Now, I was being referred to people that the neurosurgeons and neurologists and orthopedic surgeons and internists didn't know what to do with. They had all these patients who didn't have their problem fixed by the usual conventional approach. So they said, okay, send them to pain management and rehab. And that was me. So I was seeing a lot of the people who just fell through the cracks and didn't have their needs met. So that's how I got interested in more alternative and complementary approaches. And I went on and studied osteopathy, which is a hands-on healing art, and functional medicine, which is all about nutrition and looking at the whole person as one system. And then mind-body medicine, which is about using the power of your mind-body connection. So let's talk about the perspective of integrative or functional medicine and how it's different than conventional pain management. So I'm going to start just with a case. And this is someone I saw a couple of decades ago. I mean, I've been practicing since 2000 and literally have seen about 40,000 patient encounters. And I've seen someone like Jody dozens, hundreds of times. And Jody's situation was that she was in a bad car accident, head-on MVA, 5 years before I saw her. And at the time, she was okay. She was worried about her husband who broke his leg, and she was feeling okay. And when she saw me, he was fine and back to work, but she was having this whole sort of conflagration of chronic pain. Like, she started having pain in her neck and her upper back, and then it spread to her lower back and her leg. She developed insomnia and anxiety, abdominal pain, irritable bowel syndrome symptoms, as well as migraine headaches. These kinds of cases really stimulated me looking more deeply into what is the best way to deal with these complex kind of pain problems. Greetings, folks who just showed up: Teresa and Marcia and Helen and Mas and Joy. What a great name. So we're talking about, why do people fall through the cracks? Why do some people not get better where other people do? And so let's talk about that. So the model that I learned in medical school and residency training at the world's greatest hospitals was kind of this orthopedic neurologic model, where you're really looking at what's the problem. Is it a disc? Is it a tendon? Is there a ligament torn? Is there a broken bone? Is there a nerve? And if there is, how do I fix it? And that's great if you find one of those things and you have a way of fixing it. But a lot of times we don't, and the person's still suffering. So what's up with that? Why is that happening? So this is kind of the decision-making process that I saw. Like, I worked with a lot of orthopedic surgeons and neurologists. And it's like someone comes in with musculoskeletal pain, and the question is, do they need a procedure? Can I do an operation or inject something? And if the answer is yes, then they do the procedure. And if the answer is no, it's nothing obvious to do, well, then give them non-steroidal anti-inflammatory medicines like Advil or, Toradol, whatever it is, and then send them to physical therapy and mobilize them, or maybe immobilize them if there's something that seems strained, like putting in a cast or something like that. And just so you know, I'm going to talk for about half an hour to 40 minutes. We'll kind of go through this whole topic, and then we'll pause and have some Q&A. So just letting you know that in advance, okay? I'm going to go like this. Hang on 1 second. Great. Okay, so what happens with this orthopedic decision-making model is that, okay, suppose the person doesn't get in better. They see the orthopedic surgeon again a month or 2 months later, and it's kind of the same question. They're not necessarily bringing anything new to it. Maybe they're doing some new imaging, but again, if they don't find something that they can fix, well, more anti-inflammatories and physical therapy. If they get better, great. Okay, those are the people who did well. I'm happy to hear that when that happens. And then some people get that procedure, and then again, like some of them get better, some of them don't. And people kind of go in this loop, and they spend 6 months going back and forth to the orthopedic surgeon or the neurologist, and they're not getting better. And then they get what we call chronic pain. And that pain is persistent and it's not getting better. And sometimes it develops into chronic pain syndrome, which is a whole set of other problems that go along with chronic pain that really ruin people's lives. And those are the people who've been coming to me for 20 years. So let's unpack, what is this chronic pain syndrome? And I got a little whirlpool here because that's the way people often describe it. It's sort of like, well, there was this one thing and then another thing and another thing. And then like, whoosh, like things started to just get out of control. And so for some people, it becomes a full-blown thing like this. For some people, it's less intense. I'm going to share the whole picture of like all the things that happen to some folks. And, you know, if you're dealing with some kind of pain problem, see if you see yourself to some degree in that, if not completely. And the way I see it, what happens is that pain gets more severe. It spreads to other areas. There can be insomnia or anxiety or depression, what we call mood disorders. Sometimes there's disuse, it hurts, the person doesn't want to move, they get weak, they start to become disabled and unable to do stuff. Sometimes gastrointestinal problems like constipation, diarrhea, pain in the belly, gas, bloating, reflux. And then there's the whole brain fog, concentration thing, or loss of motivation that happens for a lot of people. And so it's really like this whole cycle of things that sort of are all connected. And I've seen people come in with like 8 different problems, and they've gone to 8 different specialists who gave them 8 different medications, or maybe 10 or 12. And the thing that I've discovered over the years is that these are all related to some core underlying issues, biological, physiological imbalances that kind of spiral and cause all these different problems in different organs, depending on the person, depending on your particular disposition, your genetics, your history, and all that kind of stuff. And so with the integrative model, we go more towards the cause, the fundamental things that are creating that vortex that shows up as symptoms in so many different organ systems. Right, last thing, behaviors, stuff like substance abuse, relationship problems, difficulty with work or other roles, family roles. And this is a person's life spiraling and getting sucked down. So the way I've learned to see it is that there's a number of vicious cycles in chronic pain, things that happen in the physiology. And we're going to talk through them, these 7 different things that kind of like each of them has their own snowball effect, and they all relate to each other. So we're going to unpack each one. Pain sensitization, where the pain processing system gets more sensitive. Autonomic imbalance, which is that stress relaxation balance or imbalance, where pain kind of shifts things towards a stress response, which leads to anxiety, which spirals, right? Neuromuscular or fascial imbalance, where the tissues of the body aren't functioning. This stuff doesn't show up on MRIs or X-rays. It shows up in a really good clinical hands-on exam that I learned to do from osteopathic physicians. I didn't really learn it during medical school and residency in the best hospitals. Then there's this whole gut-brain immune dysfunction. We'll talk about that. Problems with sleep, mood, behavior. These are all vicious cycles that feed into each other and feed into themselves. And that's part of what creates this vortex that gets things worse and worse. Okay, we're going to keep going. We're going to talk about this stuff. We'll have Q&A at the end. If you're just showing up, welcome. I think Catherine, Natandra just showed up. Welcome aboard, Teresa, Anne. So let's talk about these vicious cycles, pain sensitization. The first thing to know is that pain is not like a light switch. It's not like you got a wire, you flip a switch, there's pain. You do have sensors in your body, right? And this is a picture from Scientific American. And what you're seeing over here is this is a sensory nerve that senses things like pressure or heat or irritation. And when that gets activated, it creates like a pain signal. And that signal goes up the nerve to the spinal cord. And in the spinal cord, it talks to another nerve. And then it goes up the spinal cord to the brain. And it goes to this core part of the brain called the thalamus. From there, it talks to other nerves. And then it goes out here to the cortex. That's the place where you actually sense it and go, gosh, I've got burning in my hand, or pressure, or throbbing in my arm, or whatever the sensation is that you see. But then there's this other pathway that goes up to the emotional centers of the brain. And that's what we call the motivational place, because pain is meant to be a danger signal. Like, hey, what's wrong? Do I have to run away? Do I have to fight something that's biting me? Do I have to deal with a fire? It's meant to wake you up so that you take action. And that's fine in the short term. But if pain's chronic, what you've got is this activation of that emotional response that's going, whether you're noticing it intellectually or it's just happening in your physiology. So we'll talk more about that. The key thing I want you to hear from this slide, this is really important, so pay attention, right? That this pain processing system has places where the nerves talk to each other. And that signal gets processed. It's almost like there's little amplifiers in there, right? And so those amplifiers can turn up or turn down. It's kind of like you take a smartphone and you play a song on it. It's kind of like you sort of hear it. But if you plug it into a big amplifier with a surround sound system and turn the volume up to 8, boom, boom, you've got a huge song going on. And so for many people, there's a sensitization where the amplifiers get turned up. So that's the pain processing system gets sensitized. And there's things that we know that cause it. Here's your pain processing system. And here are some of the things that sensitize it. Sorry about that color. It might not be so easy to see, but persistence of pain makes it more sensitive. Stress hormones, inflammation, certain neurotransmitter changes, things like serotonin and norepinephrine and dopamine, negative emotions or affect or fear. It actually turns up the volume. Beliefs about pain that it's like, oh my gosh, is this a dangerous thing? Feeds into the sensitivity on a biological level. We're not just talking about someone being anxious and like get over it. We're talking about chronic stimulation of pain that stimulates this like, oh my gosh, I'm never going to get better. Oh my gosh, I'm never going to be able to work. I'm not going to be able to be a wife, a husband. I'm not going to be a man, like whatever it is that takes away your sense of who you are and the belief you have in yourself. Biochemistry and nutrients, also really important. And then there's things that turn down the volume on the pain, and that's where the therapeutic part comes in. So we're going to hopefully get to that too. Okay, autonomic imbalance. You have a stress response, a relaxation response. This is a map of your autonomic nervous system. There's a stress response, a relaxation response, and they're meant to be in balance, right? The sympathetic branch is your stress response. Fight, flight, freeze, get up and go. I got to run away from the fire. I got to fight off the tiger, or even I got to run and play a soccer game or dance at a wedding. That's a stress response. But when you're doing something positive, it's associated with a lot of biochemistry that encodes this is fun. And this is fun is the different kind of stress than this is scary or this is dangerous or I don't feel safe. Right? And so a stress response with I don't feel safe feeds into pain. We've also got this relaxation response. That's about recovery and repair, rest and digest. And this autonomic nervous system is built into your brain and spinal cord and feeds every cell of your body. And here's kind of a cartoon showing your sympathetic nerves going to all your organs, as well as your muscles and your tissues. And then your parasympathetic branch going to all of your organs. So that's meant to be in balance, right? You know, look at this little curve here. You have stress, you relax. Bigger stress, more relaxation. Stress, relax, stress, right? You know, you go through your day, but the baseline stays kind of stable. And then when we have autonomic imbalance, when that stress response is dominant, when the person doesn't have a chance to recover, when they're chronically being bombarded in pain, when you can't sleep, when you get anxious, that's a stress response that's out of control. and the stress is overdriving the relaxation. And so what ends up happening is that overall bodily stress level goes up. And this is not just like, oh, I feel stressed out. It's a bodily biological stress, right? You got a big nerve. Do I have a picture of this? Not yet. There's a big nerve in your body called your vagus nerve in the base of your skull. It's a relaxation nerve. It goes to all the organs in your gut. We've learned over the generations that when your vagus nerve is stimulated, when you're relaxed and you feel good, it actually decreases inflammation in your body. When you're stressed out, your vagus nerve turns off and it increases inflammation. And that's pro-pain and causes all sorts of bodily problems. So here are some of the things that happen when a person has autonomic imbalance and an overactive stress response. We talked about pain sensitization, increased inflammation, mood disturbances, difficulty sleeping. We talked about that vagus nerve thing, and then gut dysfunction. Maybe you've heard about leaky gut or intestinal hyperpermeability, or decreased or increased gut motility, where your normal squeeze, your normal movements are off, and either you're constipated or you're going to the bathroom all the time. And then there's this thing of the biome. All the bacteria that live in your gut are profoundly involved in sending signals to your brain, in modulating inflammation. And this is all part of these vicious cycles. So let's talk about that gut brain immune imbalance thing, right? This is just like a cartoon. And here's the brain. And here's that big vagus nerve. And this is like a cartoon of the gut. And you got all those bacteria in there. And those bacteria that live inside of you are symbiotic. They're meant to be there. They're good. They produce like healthy metabolic products and proteins and substances that help your body regulate. When there's an overactive stress response, when that vagus nerve gets inhibited, the biome gets out of whack. And this nice barrier that separates your gut tube, which is really the outside of your body, separates your gut tube from the inside of your body, which is all around the gut. You've got blood vessels and immune cells, and that gut barrier starts to break down. And we call that intestinal hyperpermeability. When that happens, it's a pro-inflammatory state. And that's part of what this cartoon is showing. This is from a mainstream neurobiology of stress journal. And it's talking about all these inflammatory chemicals that come out when that vagus nerve is inhibited and then feed back into the brain, and changes in the chemistry that feeds into the brain and can create anxiety from your gut getting out of balance. Anxiety and depression are related to gut imbalance. Pain sensitivity related to gut imbalance. It creates systemic inflammation. We're not talking about the kind of inflammation when someone's acutely ill and things are red and hot and febrile. We're talking about low-grade inflammation. And it's been, when you look into specialty journals now, right? Like when I was coming up and I was just finishing residency, just starting to work, people were talking about leaky gut and the biome like holistic doctors. And we all thought it was a bunch of garbage. But now you look in every specialty journal, whether it's neurology or psychology or infectious diseases, orthopedics, psychiatry, they're all talking about gut-brain immune dysfunction as driving all these different chronic illnesses. And this is what happens when people have chronic pain that gets untreated. It's a process of systemic inflammation where the whole system sort of spirals and spirals like we talked about. Okay. I know it's a lot of information. Take in what you can. This is going to be recorded. You could probably get the recording from the practice. So don't worry about it if you don't get it all. You can watch it again if you want. So sleep, mood, behavioral imbalance. This is sort of obvious to a lot of people, but if it hurts, you can't sleep. And if it hurts, you get in a bad mood. And when it hurts and you're in a bad mood and you can't sleep, you want to do stuff to feel better, like smoking, like drinking, like eating comfort foods. And all of these things feed into the biochemistry of illness and the biochemistry of pain. And it's part of the vicious cycle. And so breaking these cycles, right? This is part of this whole thing, right? That your mental and emotional state influences pain processing. Remember that whole drawing we saw about how pain is processed from the point where it's in your hand to the point where it gets to your brain. Your emotions, distress, and beliefs are part of that. And so perceived pain changes that and worsens that and feeds into that. So mental, emotional, behavioral changes from chronic pain that feed into the vicious cycles and can make the pain worse, that can feed into the autonomic imbalance, feeding into that gut dysfunction, systemic inflammation. So neuromuscular fascial imbalance. This is super important. This is kind of where I started with integrative medicine, because I was doing hands-on exams and finding all these tender points, and like other doctors were ignoring it. And I was working with therapists who were like working on the tissue and getting people better. We were getting people better that other docs thought were hopeless. And they'd go back to the other docs and they were like, oh my gosh, you got better. How'd that happen? Well, I went to see Dr. Triller. He treated my myofascial pain. They're like, oh, I don't believe in that. But meanwhile, the patient was like sick and getting worse for 5 or 8 years. And we just worked the knots out of their tissue and they got better. Okay, so what am I talking about? What is fascia? Fascia is the connective tissue. I hope I don't have any, like, if any of you are offended by the sight of meat, I'm sorry. But fascia is that stringy stuff, right? This is like the connective tissue that holds your muscles together, attaches your muscles to the bones. It becomes your ligaments and tendons. If you took your whole body and dipped it into some sort of special stuff that dissolved everything but the connective tissue and the fascia, you'd see these like dense bands of fascia that are holding your joints together, like your hips and your knees and your elbows and your shoulders. You'd also see fascia wrapped around all the muscles. You'd see it wrapped around your lungs, around your heart. Connective tissue envelops all of it. It's the scaffolding on which all of your nerves go and your blood vessels go. When the fascia gets restricted, it can generate pain. It can generate pain that goes from one part of the body to the other. There's a couple of cartoons, right? It's like you got muscle here, right? These are the pectoral muscles. And then you got fascia attaching the muscle to the bone. You got these abdominal muscles. And then this is fascia kind of holding the muscles together. Fascia was the stuff that in medical school, they taught us to dissect and get it out of the way so you can see the important stuff. And what I'm seeing is that fascia is the important stuff for a lot of people with chronic pain. And this is a drawing that's been compiled by a lot of body workers who see these fascial lines and work on it. And this is part of why, okay, I got low back pain. And then like after a long day, I get neck pain. What's up with that? Well, it's all connected. The muscle, the fascia, it's all connected. There's these patterns spiraling around, going to different parts of the body, going across the body, going down. And so I see this in my practice all the time by examining carefully and seeing that, this person's got pain in their leg, but it's coming from their lower back, and it's not a nerve, it's the tissue. It's the tissue that's got an issue. And this is like a bunch of different diagrams of that, all these different fascial patterns. This is on the front of the body. Like, oh, it hurts in my chest and that goes out in my arm. Why? Fascial connections. All right, hormonal imbalance. That whole stress response we talked about, that fight, flight, freeze response also has hormones to it. You've probably heard of cortisol, epinephrine, norepinephrine, right? Your adrenal glands produce cortisol. When you have chronic stress over months and years because of pain, because of anxiety, because of early life traumatic events or really bad things like trauma or really bad illnesses that prime the system and make it more sensitive to stress and danger, that create a certain kind of vigilance, those cortisol levels get all out of whack. Your cortisol level is supposed to pop up in the morning, that wakes you up, and it kind of goes down during the day. And then your melatonin comes up at night and puts you to sleep. And they're kind of in balance. Cortisol, melatonin, cortisol, melatonin. But what happens is when a person's chronically under stress, the regulation of that whole system gets out of balance. And that not only affects the cortisol system, but can affect the thyroid. It can affect the sex hormones. That's why so many people who, women who've been traumatized early in life, who've had tremendous amounts of stressors, frequently will have irregular periods or really painful periods because the sex hormones get out of balance from the chronic cortisol activity. The cortisol activity inhibits the sex hormone activity. It interrupts it and creates all sort of havoc with it, and that can feed into pain. So these are those vicious cycles. We just talked about all 7 of them, and I'm just trying to diagram here that they're all connected. If we really wanted to do this, there would be a line between each one of these, and it would just get like stupidly complicated. So I didn't make those other lines, but they all feed into each other. And that's how chronic pain develops. And in a given person who has some kind of traumatic or illness that develops some sort of pain problem that's not getting better, any one or more of these issues may be active depending on your particular issues, depending on your particular genetics, your previous, health history, your circumstances, your life habits. All these different things determine just how bad this goes. I didn't talk about fear avoidance disability. What happened? Hang on a second. That's really important. Oh yeah, okay. So this is something that like every chronic pain doctor should know, and some don't. But for some people, what happens is that they get injured and they have pain, and that pain scares them. And they think scary things about it. We call it catastrophizing. You got some sensation that's stimulating that autonomic fear response, right? Like we talked about at the beginning. So it's a fear-inducing sensation. So it's normal to be scared of it. So that person, because it hurts, doesn't want to do stuff. So they don't move as much. They sit on the couch. They don't work. They don't do the stuff they need to do to stay active. And that actually makes the body sicker, because the nerves, the muscles, the fascia, the activity of the body gets less able to do what it needs to do. And you get this thing called disuse, which often leads to disability, which feeds into depression and feeds into like, well, what the hell am I if I can't do the stuff that matters to me? And it's a horrible, vicious cycle. And part of the healing process is to work with that emotional fear and help the person kind of recondition so they actually deal with it and work through it. And that's why in the best pain centers, it's not just a doctor who's, thinking about what's wrong. It's also a psychologist, a social worker. It's physical therapists, occupational therapists, helping the person work through the fear and re-enabling the body to function again. I worked in contexts like that for a couple of decades. Now, what I do is a much more involved integrative approach that we're going to talk about right now. I'm going to talk hopefully for only another 15 minutes, and then we'll have a little Q&A. All right. Hope that's good for y'all. Let's do this. If anyone has pressing questions in the chat, feel free to pop them in there. I can't say for sure I'll be able to respond, but I'll try. Okay, so you got a chat there. You can just like type a question in there. And if I see it, I'll try to respond to it as we flow, or you can just type it in there. And at the end during the Q&A, we'll talk about the questions. Okay, so let's go forward here. All right, those vicious cycles, everything's connected to everything else. And it's kind of like this current flowing downstream, where these are some of those vicious cycles, some of those issues, some of the biological imbalances that go along with chronic illness and pain. And it is like a stream flowing downstream. And most of my conventional medicine is, well, okay, let's go downstream and just treat the symptoms. And in functional integrative medicine, we try to go upstream as much as possible. We try to get towards the root cause, and we try to turn that stream backwards. We try to unwind those vicious cycles, whether it's the disuse disability cycle, the fear avoidance, the gut dysfunction, the autonomic disturbance, all those other vicious cycles that we talked about. We're trying to turn those backwards. Okay, how do we do that? This is a framework that I just kind of came up with over the years to make it simpler, because there's so many different interventions, and it's helpful just to kind of group them. And I call it 3 M's, right? And the 3 M's are your movement or structural system, your metabolic biochemical system, all your biochemical reactions, your gut function, your immune, your hormones, your nutrients, all of that, even your brain chemistry. And then your mind-body system, the way your thoughts, emotions, beliefs are connected to everything else. And this just kind of explains that in more detail, that the mind-body system is thoughts, emotions, your awareness, previous traumatic experiences, beliefs you have about yourself, anxiety, depression, all that stuff can worsen pain, or it can enhance things. And more important than just worsening pain, it can drive the physiologic changes that can trigger, worsen, or perpetuate pain. We talked a bit about that movement system. We'll dive into that some more. And then all your biochemistry, immune, hormones, biome, nutrients, toxins. I want to acknowledge 2 questions. What are your thoughts on dry needling? Great one. We're going to get there. And can the use of SSRIs or SNRIs help with chronic pain? Simple answer is yes, and we'll talk about why. You know what, let's talk about that second question now, right? Because SSRIs are standard like antidepressant, anti-anxiety medicines, things like Paxil and Zoloft, Prozac, and other, more recent medications, Celexa. Those mainly are working on serotonin, and often they help a person sleep or have less anxiety. And if the person's sleeping better and having less anxiety, then they're having less reactivity to their pain. They're better able to stay focused and like stay active and do what they care about. They're living with less distress. So they're often able to function better. And for some people, that takes a huge aspect out of that pain. Remember that little drawing of like how beliefs and emotions and pain sensitization are deeply interconnected with each other? Well, turn down the negative beliefs and emotions, and frequently the experience of pain gets better. Because let's remember, pain is subjective. Like we all know that guy, maybe you've seen him in a movie, someone like breaks a bottle over his head and he just like looks at him and goes, "Arr," because he's just like stoic. He's like built, like that might have hurt him, but he's not thinking about it. He's not paying attention. He went through the army. He's a special forces guy, or he's just wired to not feel pain or not react emotionally. Remember those two pathways? There's a sensory pathway, the emotional pathway. For some people, that emotional pathway is really strong. For those folks, treating the anxiety is even more important. And it's not a value judgment. It's not like, hey, you're weak because your anxiety makes your pain worse. No, you're emotional. That's the way you are. Certain cultures are just normally more emotional. I worked in inter-city hospitals, and there's certain ethnic groups that like, they just have a culture of feeling and emoting and like, and when something hurts, it really hurts them. And then there's cultures like Northern European, Slavic, British, just stiff upper lip, stick with it, tough it up. Obviously, these are big generalizations, but important to use of anxiety medications and depression medications. SNRIs, that's a combined kind of medication that also shifts norepinephrine. And so that's medications like venlafaxine or Cymbalta, which are part of actually blocking the pain pathways in the spinal cord. And those have a more direct, they treat anxiety and depression, but they also treat the actual pain pathways themselves, which is why they're sometimes used as first-line agents. I think Cymbalta was approved for back pain, although more recent studies have shown, okay, maybe not so great. It's complex, it's very individual. So sometimes I use those meds for some people and sometimes I don't. It's very much patient preference oriented. Anne is saying so true. And someone's saying, Andrea, I'm on dizipramine for chronic neuropathy of that around the foot. Okay, so dizipramine is what we call a tricyclic antidepressant. That has that norepinephrine activity. Depending on the dose, it may or may not be treating depression and anxiety, but it can be turning down those pain sensitization pathways. And that's why it gets used a lot. Right. Right. She's on it and she has to take her time and increase the dose. Exactly. Because you got to find the right dose. Right. Yeah, it's true. Dizipramine is a good one for sure. I'm not sure that they're compensated less for dizipramine than other medications, but it's hard to know. There's a lot of crazy stuff going on there in the world. All right, let's go forward. Let's think about this from kind of integrative, holistic point of view. So we got 3 M's: mind stuff, movement, motor system stuff, metabolic stuff. We're going to talk about each 3 of those, like what things can be useful. And look, the way I think about this is like this, that there are a lot of doctors out there who are calling their practice integrative medicine because they're adding on this or this, the extra tool. Like we do acupuncture. We have someone who does visual imagery and meditation, and that's great. But the question is the doctor really thinking holistically about the problem? Are they looking at the systems biology, how the problems all relate to each other? And in my experience, like as I really got that in the past 10 years, this is after 10 years of practice, during the my years 10 through 20, it became a completely different ballpark in understanding and reading the research and seeing how these things are all connected to each other because they're integrated. This drawing shows mind, movement, metabolism, they're overlapping because they're completely interpenetrating. And then in the middle, there's this little glowing circle. And for those of you who believe you've got a divine soul, that you've got a part of you that's higher than your being, than your physical being, well, okay, that's there too. because that's coming in and illuminating your life. You know, that's the way I understand people. We've got a divine soul that's constantly irrigating and illuminating and trying to support us to live and be our best, highest self. And the question is, are we activating that? Are we connecting with that? Because it's potentially an ally in healing. And all these things are interconnected with each other. So let's go forward before we run out of time. Let's talk about this movement structural system, right? So there are focal pain generators, things like arthritis, whether it's inflammatory or degenerative or both. Things like myofascial pain that we talked about, which is like muscle, fascia, tightness, twisting, spasm, distortion, connective tissue not functioning properly. That generates pain. Nerve compression, neuropathy, bursitis, inflamed structures that can like be in the shoulder, the buttocks, the hips, all kinds of different places, old fracture, other structural things. Those are some of the issues that can be going on that we need to think about. And then there's this sort of overall structural integration or lack of it, right? In my experience, integrative medicine applies to the whole body, right? Because everything is one unit. I've had people come into me with horrible knee pain who got 3 epidural steroid injections. They were thinking about having low back surgery to address a presumed nerve compression. I put my hands on the person's feet and I was like, what the heck happened to your ankle on that side? And they're like, oh, well, yeah, I twisted my ankle really bad. When was that? Oh, about 6 months before my knee started hurting. So we just fixed the ankle, got the ankle mobilized and feeling better. And she's like, oh my gosh, my knee's starting to feel better. It's the integration of your structure. I had a lady come to me years ago with horrible pain in her pelvis. I'm sorry, horrible pain in her Achilles tendons. She went to see an orthopedic surgeon who injected it and heel cups and physical therapy. She spent 2 years doing this whole route. He actually did surgery to lengthen her Achilles tendon. And each time her pain got better for like 3 to 5 months. I tuned in with an osteopathic exam, okay? And this might sound crazy, but the neurofascial system of the body is one unit. And when you train yourself, you can feel the whole body as one unit. And I'm listening to her Achilles tendons and her heel, and I'm like, what is going on in your gut and your pelvis? And I went up and examined her lower back and her pelvis, and it just felt like chaos in there. I'm like, did something happen here? She's like, oh yeah, I had 5 children, and then I had like pelvic support surgery. And I was like, well, when was that? She's like, blah, 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 blah. That was like 9 months before the pain started in your hand. Yeah. So I sent her to a special physical therapist who knows how to work on the pelvic tissue, who released the pelvis, released the back, released the nerves in the back. The pain in her ankles went away completely. She went back to her job running up and down 4 flights of steps a day. And the problem was in her pelvis, not in her ankles. So there's a whole body unity of structure, of guarding patterns, of altered reflexes, of neurofascial patterns. And that's really important to address. I see that over and over again, and it's been the big thing that has saved hundreds and hundreds of people, is putting them and getting them proper tissue neuromuscular treatment that addresses the whole body as one unit. Most physical therapists are not doing that. Most orthopedic surgeons and neurologists are not thinking about it. They're thinking focused, what's the one problem? And they're not thinking, who is this person and what's going on with the overall structural system? So what do we do about it? Well, there's treatments that are done to you or with you, hands-on stuff, right? Like massage, physical therapy, occupational therapy, chiropractic, osteopathic. Someone asked, what about dry needling? Dry needling is a technique that's been extracted from acupuncture of using needles to work either on anatomic or fascial structures or actual meridian structures from traditional Chinese medicine. And that helps a lot of people in good hands. What I'd say with any of these manual physical treatments, and I'd include dry needling here, I just didn't because I didn't want to make the slide too busy, right? But, you know, there's one aspect, which is the technique. And there's an other aspect, which is the practitioner. You want a practitioner who's really good at what they're doing, who's not only done the right training, but has an ongoing learning orientation where they're constantly learning, where they're thinking critically, where they're questioning their assumptions. It's about their personal qualities that makes them distinguishes the good from the great. And if you have chronic pain, you want to find the great, right? So acupuncture, and then skilled movement training, right? Like going to a really good physical therapist who analyzes movement patterns and teaches you, okay, move your knee just a little bit right there, tighten up the muscle in your pelvis, hold your pelvic floor in, retraining the movement patterns so that your body functions as one unit. So that's stuff that's done to you by somebody else. There's stuff you do for yourself. Typical gym exercises like strength and coordination. Your muscles are not just the things that move you through space. They are metabolic organs. When you use your muscles, when you do aerobic and strength training, you're producing a whole set of chemicals that are affecting brain function, modulating stress, blocking pain, enhancing nerve development and nerve regeneration. Exercise is so profoundly important. So strength and coordination training, aerobic training, and then something that you could call mindful movement. The reason I'm a big fan of mindful movement is some people with really bad chronic pain can't do typical gym exercise because it flares them up and it hurts too much. I'd love to do a little poll and ask you all how many have gotten worse from exercise. I bet half the people here would say that. And that's my experience in my practice. So when they're well taught, exercises like Pilates or yoga or Tai Chi or Qigong, Feldenkrais, these are retraining body awareness movement training practices that help reestablish the normal reflexes, that help the person tune into the fascial system of the body, right? A word about yoga, a lot of yoga teachers don't teach that way. It becomes very like forceful and goal-oriented. You know, you see those magazines where like the person's twisted in a pretzel, you know, it's like this whole thing, like you need to get into the pose, which is completely the wrong thing if you've got bad chronic pain. What you want is gentle presence and awareness. Right. Andrea's checking in. I've done Feldenkrais. It's wonderful. And Catherine's saying yoga helps me tremendously. Great. Yeah. And those are incredibly powerful tools if they're taught right, if you do it right. The key thing is awareness, you know, so it's like I can go into a yoga pose, right? You can't really see me, right? But the whole idea is meet the tension in my body, meet it, breathe, relax. That turns off those reflexes and protective guarding responses. I don't know if I spoke about that enough, but like you touch a hot stove by accident, pull your hand back before you even know it in your brain that you touched a hot stove. It's a reflex at the level of your spinal cord. If you got a chronic injury or something that's chronic painful, whether it's neuropathy, a hot, swollen, inflamed joint, a slow to heal fracture, multiple surgery in a particular point, that's trauma. That creates protective responses in that joint, in that limb. You know, you walk around with a painful foot for long enough, your lower back starts to hurt because every time you put your foot down on that painful spot, your lower back muscles are going, get that foot off the ground, it hurts. It's a reflex. And so getting that to unwind happens when you get someone to get in there and work on it hands-on, or when you do very gently, you meet those reflexes and you breathe in and you relax and you open them. It's not like stretching a piece of meat, because if you do that, you'll just activate those reflexes. So that's where the mindful movement things come in. Wow, cool. Catherine's saying, most surprising, the yoga helped her TMJ. So I wish we could speak, but I guess what I'm imagining you're saying is, hey, I had pain in my jaw. I did all this stretching my back and my legs and my trunk and my arms, and then my TMJ went away. Why is that? That's that integration of your whole neuromuscular skeletal system as one unit. And that's why the integrative approach is so important. And I've seen that happen. I can't count the times, you know, like, okay, the person deals with what's going on in their back and their headaches go away, or suddenly their vision gets better, or any number of things that relate to your structural movement system is one unit, head to toe, bones to skin. And proper treatment of it depends on addressing all of it at once. Okay, let's move forward. Metabolic biochemical healing. This is going to go kind of fast. This is the realm of functional medicine and real integrative medicine, because it's really about getting at a whole bunch of different biochemical metabolic issues. The first of it is just analgesic nutrients. This is not everything. These are some of the things I use in my practice a lot, right? Stuff like CBD or curcumin, boswellia. Curcumin, boswellia are plant-based products that have been shown to work as well as medications like ibuprofen or Celebrex in people with osteoarthritis. They have significant activity against inflammation and pain, but don't have the same side effect profile. You know, non-steroidal anti-inflammatory drugs actually worsen leaky gut and intestinal hyperpermeability. So you're taking an anti-inflammatory medicine that reduces your inflammation in the short term, but in the long term, if it gives you leaky gut, it gives you systemic inflammation, and it's worse. So anyhow, same E, magnesium, omega-3. Magnesium needs to be taken with B6. It's a cofactor. It can be relaxing for muscles. When you have chronic stress, your body dumps magnesium. Magnesium is an intracellular. It's in the cells. Your blood levels are maintained relatively normal because if your magnesium drops too much, your brain and your heart stops working and you die. So your body maintains serum magnesium as best it can. A lot of people have depletion, too little magnesium in their tissue, but their serum level is normal or maybe on the low end. Unless you have kidney disease, magnesium, like kidney insufficiency and decreased kidney clearance and all of that, taking too much magnesium, you're just going to pee it out. It's not going to hurt you. And so like almost everybody I see who's got any kind of muscle pain, unless they've got kidney problems or known intolerance, magnesium is foundational because it's hard to get in the cells. You just need to keep taking it. Omega-3 fatty acids have anti-pain properties. They stabilize the membranes of your cells, especially your nerve cells. We'll talk about other things with overlapping properties. CBD is on here, medical cannabis for sure. Great analgesic, CBD sometimes just by itself without the psychoactive properties. As you may or may not know, cannabis has two main constituents. One's THC, that's the part that gets you high, although it also has pain blocking effects, and CBD, which is not so psychoactive, although it can reduce anxiety and it can create a neurologic balance in people with PTSD. It's actually good for PTSD. So those are important things. Healing the gut. You know, we talked about that whole brain, gut, immune axis. If your gut is got altered biome, if you've got hyperpermeability, you're going to have systemic inflammation. That systemic inflammation frequently becomes brain inflammation. Anyone got fibromyalgia, chronic fatigue, brain inflammation states, among other things. They're complex. There's a lot of factors for sure. But there's an aspect of the immune cells in the brain getting activated, the glial cells. That's part of what creates the sensitization. That's part of what creates the brain fog. It can contribute to anxiety, insomnia. Like, I'm exhausted, but I'm wide awake and I can't sleep. What's up with that? The brain is hyperactive. When the glial cells get activated, they produce more glutamate, which is an excitatory neurotransmitter. It doesn't mean that eating glutamate is going to make you have more of that in your brain because that's in your gut. It's different. Anyhow, let's go forward. Teresa's asking, what kind of magnesium? Okay, I was taught to prescribe magnesium oxide. And then at a certain point, I saw that magnesium oxide, all magnesium is very difficult to absorb. Magnesium oxide is the worst. So there's a bunch of what we call organic salts of magnesium, and those tend to be things that end in ate, like magnesium citrate, magnesium malate, glycinate. I like magnesium glycinate because it tends to be somewhat relaxing. There's a lot of different formulations of it. There's a lot of talk that's made of like magnesium topical creams and sprays, and I've never seen anything that tells me that they work. Maybe they do. Magnesium salts bath is probably better, like Epsom salts, right? Like, why do people go to the Dead Sea? Because it's full of magnesium and other salts that kind of get in and replenish nutrients. So anyhow, gut healing, really important. Dysbiosis, motility, getting the gut healed shifts inflammation, shifts that brain imbalance, and is a big thing for people who have that kind of problem. It's really complex. There's a lot of different layers to it. I'm not going to unpack it completely. It's a whole topic unto itself, but it's one of the main things we do. You know, like Hippocrates said a long time ago that all illness starts in the gut. And a lot of philosophers have, and healing doctors have noticed that over the centuries, and modern medicine's coming around to that too. So I think we missed a page. Okay, whatever, fine. Let's just keep going. There are anti-inflammatory substances. Cinnamon, curcumin, nutmeg, ginger, spices are anti-inflammatory. They're also antibacterial and antiviral. There are substances that are called polyphenols, which are the colored substances in vegetables and fruits. I recommend most of my patients eat the rainbow. I give them a sheet with like all these different colored foods. Polyphenols are things that you find like in pomegranates and, you know, red skin grapes and like the list goes on and on. But the point is they mop up free radicals. They contribute to reducing inflammation. Cannabis and CBD, THC have anti-inflammatory properties. Vitamin D is a hugely important anti-inflammatory. It's not just a vitamin. It's really involved in immune regulation. Helping sleep and autonomic imbalance. There's a number of substances that aren't drugs that actually can help with that. I've had a lot of people with anxiety who come in on medicines like SSRIs or even benzodiazepines. And it's like, I want to get off of these drugs. They're messing me up. They're messing up my sex life. They're making me a zombie. So phosphatidylserine, ashwagandha, rhodiola, L-theanine, that's the active ingredient in green tea. Why is it that green tea like wakes you up? It's also relaxing. L-theanine. Magnesium itself is a calming substance if it gets into your tissue. There are powdered magnesiums that are probably more easily absorbable. A lot of times I recommend those at sleep time. And again, it's very individualized. For some people, this autonomic balance and sleep is so intense that I use medications, right? I'm not a big fan of benzodiazepines because it's well known that like we're supposed to have 4 stages of sleep. And the deep sleep is the restorative sleep. The lack of the sleep stage that messes people up is that deep sleep if they're not getting it. That's what really messes up the metabolism of the brain and the excitability and inflammation. And benzodiazepines like Valium and Xanax and Klonopin, they knock you out, but it's not deep sleep. Alcohol is similar. Knocks you out, but you're not getting deep sleep. That's why people like wake up in the middle of the night frequently. So I much favor using these substances, doing things to calm the nervous system, exercise. There's a whole bunch of different lifestyle things that can help with calming and sleeping and autonomic balance. And then these substances, and sometimes, okay, so, you know, trazodone is a good sleeping medication and it doesn't have so many side effects. There are others that I sometimes use. Cellular energy, magnesium, B complex, CoQ10, acetyl L-carnitine, alpha-lipoic acid. These are substances that actually help your mitochondria. Your mitochondria are the organs in your cells that produce cellular energy. Fibromyalgia, why are you exhausted? Why is it that you do a little bit of exercise and you're exhausted? It's complex, but it's been shown that cellular energy is decreased. The mitochondria don't function as well in many people with fibromyalgia. For many people, these kind of nutrients not only have antioxidant effects, but they enhance cellular energy. Migraine patients frequently do better when they get these kinds. Let me add to the biochemical stuff because sometimes meds are what a person needs. In my experience, like there's something called LDN, low dose naltrexone. Naltrexone is an opioid blocker. Opioids are those pain blocking chemicals in your blood. We all have a natural opioid system. LDN is a tiny dose that temporarily blocks that system, and it causes your body to produce more of its naturally pain-blocking chemicals, the endorphins and enkephalins. That does 2 awesome things. For many people, it really blocks their pain. That's my first-line drug for fibromyalgia for a person who wants a medication. The second thing it does is it reduces a certain pathway of inflammation that's very involved in chronic pain. And so LDN is a huge thing. For some people, you know, the classic anti-pain medication, anti-nerve pain drugs like Lyrica and gabapentin can be great. They can be really helpful. For some people, they cause horrible side effects. In my experience, the main thing is like, if the doctor has a relationship with the patient and is actually listening to them and listening to what's going on, and the patient who comes in and says, every medication I get like wipes me out, please give me a low dose, but they give them a normal dose and they become a zombie and they'll never try it again. I hear that kind of stuff all the time. And if you just like pay attention and care about the person, like, okay, who are you? What makes you unique as a patient? Do you have something about you that makes you more sensitive to meds? Okay, let's start on a really small dose. Someone else mentioned dizipramine, which is a tricyclic antidepressant. Andrea mentioned that. Other meds in that class, like nortriptyline, like doxepin. also very often work very well with nerve pain, but they have to be titrated properly. And it takes a relationship. And unfortunately, a lot of docs are so under the gun and so pressured, they don't take the time. And so, they just give them the script and don't explain it all. All right, let's go forward. Let's talk about the mind-body system. Remember, metabolic, motor, function, mind-body. There's a number of things that are really important here. These are the basic skill sets. These are the basic moves that you can make. Learning the relaxation response. That's stimulating the physiology of your vagus nerve. Not only does it create a positive state of mind and reduce anxiety, and in many people help with sleep, it is anti-inflammatory. It stimulates that vagal anti-inflammatory pathway. For some people, it's really difficult. For some people, it's great. I teach a class that's free on Zoom every other week on Mondays, which is basically learning mind-body techniques just to keep people started. There's a lot of ways to learn this stuff. It can be life transforming. Don't think it means that, oh, my doc wants me to do mind-body medicine. It must mean it's all in my head. No, it's in your body-mind. It's one unit. And calming that autonomic imbalance can go a long way to reducing distress, helping you stay more functional, and turning back those wheels that have created that chronic pain situation. Mindfulness is another hugely important skill. We could spend an hour just talking about that, and you could spend years learning it. And it's profound. It's about how to relate to yourself with more compassion and more presence. How to realize, here I am. I'm not the person I was before, but I am the person I am today. So let me meet the person I am today and find the life that's still inside of me. Find the joy that's still inside of me. Realize that I get pain every day. How can I relate to it more skillfully so it doesn't freak me out and knock me on my butt all the time? Mindfulness is a coping skill for dealing with all of these challenges of pain, of chronic illness, and it becomes a skill that changes you, that turns you into a person who's more present, not only to yourself, but to your kids, to your spouse, to the guy at the bank who's having a bad day, or whatever it is. When you start to empathize with your own suffering, you start to empathize with the suffering of other people. Life becomes less antagonistic. It becomes more harmonious, and it becomes more joyful. Understanding the stress reactivity in your life. It's a process. As you get mindful, you start to notice, wow, every time I do that or interact with that person or eat that food, I start to feel blah, blah, blah. And you just start to notice it. And after a while, you're like, I don't want that anymore. And you stop doing it. Not because someone's telling you or shooting you, but just because you realize, I love my life. So I don't want to do that stuff that hurts me. And then hugely important is tools for healing trauma and emotional distress, because all of us have trauma. And if you have chronic pain, you have trauma. And whether it's full-blown trauma, abuse from an early part of your life, it should never happen to anyone, but it does happen to people, whether it's physical or emotional or sexual abuse, that creates a pattern in that whole autonomic nervous system that can be healed. Where if that traumatic event was in a war or in a bad illness or in a horrible car accident, the number of people who come to me 2 years after a car accident and they're still having nightmares. When they get in the car, they're nervous. They buckle their seatbelt and they're holding clenched fists. That's post-traumatic stress. That's affecting every aspect of your physiology. That's impairing your vagal nerve dysfunction. Healing that is part of healing chronic pain from that car accident. A lot of people don't get that. They don't do that. They just keep suffering. They get drugs and procedures and so on and so on. Right. Yeah. To me, there's 6 levels of healing. Self-regulation is stimulating that vagus, mindfulness, body awareness, emotional awareness, transforming trauma. This is whole talks unto themselves, but it's a really key thing of what I try to guide my patients in and direct them towards. And there's lots of ways of doing it. There's apps that you can get you started. There's free stuff on YouTube and Facebook that can get you started. There are practitioners that give group sessions and classes for people. And then there's individual practitioners who can teach you one-on-one and actually go deeper, right? A lot of people have chronic pain. They get referred to CBT, cognitive behavioral therapy. It's great. It's really valuable. And there's a lot of research about it because it's easy to study. Because you're teaching people how to think better. And that teaches how to function better. It can help with a lot of emotional issues, it can help with a lot of pain issues. It doesn't necessarily get at that core, deeply held emotional traumatic experience. It could be that master CBD practitioners can do that, but they're doing other stuff too, just through their presence and their skill from having decades of experience. There are deeper practices, which I should have put in the slide, stuff like somatic experiencing, EMDR. There are energy psychology techniques that you can learn online, tapping techniques. These are ways of meeting traumatic memory, meeting pain and emotional distress in your experience. It's not about going back and like blaming your mother. It's not about blaming anybody. It's about meeting your own self and using specially designed techniques that discharge that negative emotion. And by doing that, it frees things up, calms that whole autonomic balance. And then finally, activating vision and imagery, reconnecting with purpose. Visual imagery not only can help with pain, it can quiet anxiety, it can reconnect you with what you really care about. When you sit down and visualize stuff, it's a powerful way to tell your body and teach your body what you want. Almost all professional athletes and high performance people do some kind of visualization because it improves performance. It gets studied in various biomedical settings. It improves stroke recovery. It improves people with chronic pain. These are real physiologic things, and they're more and more available. And I encourage you to seek them out if you're suffering. So training groups, I do a lot of this work with people. So I made a bunch of slides about it. I think we should go to Q&A. These are all really important. I want to talk about this whole thing of self-judgment and self-blame and self-hatred. Every person I've ever met, that's an exaggeration. So many people who have chronic pain are suffering from self-judgment and self-blame and self-doubt and even self-hatred. And sometimes it's been there their whole life. And sometimes it's because like their life fell apart and they can't function and they're miserable and they've lost their sense of self. And it's really hard to cope with. But healing these things are incredibly important. And it's part of how you get your life back. All right, that's it for the slides.